After cataract surgery, the lens implant tends to stay stable for the rest of the patient's life. The lens implant lasts for many decades and will not usually have to be replaced. However, in approximately 20 to 50% of patients who undergo cataract surgery, the capsule in which the lens sits can turn cloudy over time. This can result in cloudiness of the vision and halos and some of the same symptoms that the patient experienced with their initial cataract. A simple outpatient procedure can be performed in the surgery center that can clear the patient's vision. The laser creates a small opening in the lens capsule that allows the patient to see clearly again.